Scott,
Yes, Alex.
how are you?
Doing great, man.
We're on the pod. It's recording. Um, but so for the audience here, I ran into this guy yesterday. He had a very interesting story that I thought would be really, really cool to hear. So just for disclosure, I know very little of the story. I know a little bit of the story, but not like a ton. So Scott, if you want to tell us about yourself and why we're sitting in this really fancy room right now.
Yeah, wow. I love this. I selected this room specifically because
He
it's
did
one of
request it, yes.
my favorite room in this whole hotel that we're in.
Yeah.
Right now, we are enjoying convocation
Yes.
from the AAO, for the American Academy of Osteopathy. And for those who don't know, that is a field of medicine where we get to treat people with our hands, and it is so amazing. And I'll get into how I got into the story, get into that in a bit. But so we're here at this conference, and yesterday I ran into this fine man. I was doing my test, my annual test every year. We do an in-training exam, and he was my grader.
Yes.
And so
I already graded him, so it's not conflict of interest.
We're good.
At this
we're
point.
Good. Yeah.
So yeah, I ran into him at grading. We were just chatting. I like to offer any words of wisdom or advice to trainees and just like, hey, I've done a lot of various things in the field. How can I help? But he was like, actually, I am a pathologist and switched into this. And I was like, whoa, you don't hear that every day. So I'm just curious, about your story and how things progressed. And even if you want to start, I know you mentioned you grew up like in this dry climate. So you can start with that, like where you grew up, where you went to school, how you found out about osteopathy.
Yeah, totally. I mean, and it totally builds on itself too. So I would need to start all the way back to when I was a baby.
Yeah.
So I grew up, my mom was a physical therapist.
Okay.
She was a special manual physical therapist. So she knew how to treat physiology with her hands.
Yeah.
It was really amazing growing up and seeing that. I was a big soccer player. I thought it was going to be my life, and then I got hurt, and so I didn't do that.
Yeah.
But I saw that was power, and I wanted that power. And then I decided I was going to go to medical school.
Yeah.
I said, okay, I'm going to go to medical school, but I need to know how to use my hands to treat people because I saw my mom do that.
So that was just your baseline.
That was
kind of a given. Real quick, let me just make sure.
Yeah.
Because I don't want to miss any of this good stuff. Yeah, we're good. Yeah. And I can edit stuff as we go.
Sweet.
So yeah, like we were saying, that was kind of the baseline, which is interesting because I came to know things from an allopathic perspective. My whole family, they're MDs from Korea, and they knew nothing about really manual medicine other than acupuncture, which my grandfather did. So, but it's really cool that you were exposed to that just from your infancy.
Yeah,
so
it was amazing.
Yeah. Did you know about DO schools versus MD schools? So
never heard of it.
How did you decide about all that?
So I was in college.
Yeah.
And I was trying to figure life out. I just got married. And
were you in Colorado for college?
No, I went to Weber State University in Ogden, Utah.
Okay.
Yeah.
Okay.
And so my wife and I, we were working in the gym.
Yeah.
And we're like, what are we gonna do? Like, I know I want to go to medical school, but I don't know where to go, and I don't even know where to apply. And then all of a sudden, I heard about this thing called the DO, and I'm like, well, but I want to be an MD.
Yeah.
And I was like, I don't understand, but I didn't necessarily know what kind of physician I wanted to be. I thought I wanted to be an ER physician.
Okay.
Because I was an EMT in high school.
Yeah. Sure.
So it was a natural segue.
Yeah.
But I didn't know how I was going to treat with my hands as an ER physician. And so that just hadn't made that connection yet.
Right.
And then I heard about osteopathy. I said, oh, these are full physicians? But wait, they also have an added tool, and they can treat with their hands. So it's the same thing that my mom did to me as a kid, but you have a physician's license.
Yeah.
And you can prescribe meds and do surgeries.
Yeah.
I want that.
Right.
So I only applied to MD or to DO schools.
Cool.
I applied to 4 schools. And I was like, all right. I applied late. I had a fun because I found out about it after I was after I was kind of later on in the
Sure.
season.
Yeah. Yeah.
So I ended up taking the MCAT in like April, or no, I mean in like August, and then I ended up getting my result in September, and I was like, oh, I can get in with this. Okay, I guess I'll just apply to a few schools.
Yeah.
So that's why I applied to 4.
Yeah.
And I heard back for my first choice, and I was like, yes. It
Yeah.
was Midwestern in Arizona.
Yeah.
I said that's where I want to go. There were no med schools in Utah at that time, so,
Right.
or no DO schools in
Right.
Utah.
And now there are, right?
Now there's a ton,
Yeah.
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 And so I then went on that interview. I found out, and I went on an interview 2 weeks later. I went on an interview after I applied. I went on the interview, stayed at one of my friends' houses, came back, and that was a Friday. And on Monday, I found out I was accepted.
Wow.
It was the shortest interview experience I've ever had.
That's like quite the progression right there.
It was crazy. But that's kind of how things just started falling into place.
It just lined up.
I knew that this was what I was supposed to do.
Huh.
And so when I found out about that, it was just amazing. And so I went head first into osteopathy. I did sort of make a mistake. I don't really call it a mistake.
A detour.
A detour, yeah. I love, my family's from the military, and I really love serving my country. So I did sign up for the HPSB scholarship for the Air Force. I loved it. And I, went to training before med school. Yeah. I, got all sorts of awards there. It was great. I loved being in the military. And then, so I was hoping that I'd, at least make a career, and then maybe not make a career out of it, but maybe at least do, at least 4 years to serve my country.
Sure.
I would feel good about that. Yeah. And then I was a super high performing student after, about my 3rd year. And in my 3rd year, I was on an anesthesia rotation, and that's what really got my eye. I was like, okay, I can do this. Yeah. But because sorry, I back up. In the military, they don't have the option for you to do osteopathy.
Right. It's not like a residency choice.
No.
Right.
So you have to do something else.
And then do like a +1 or
well, no, +1 after you're done.
Right, after you're done. Yeah.
They don't even let you do it. Yeah. I was like, okay, so that's kind of off the table now. So I was kind of licking my wounds there and dealing with that. But then after my 3rd year, or in my 3rd year, I was thinking anesthesia was going to be, my calling. I was like, okay, let's do that. And then during that rotation, I ended up getting hit by a car.
Wow.
Yeah.
How, like, you were just walking, and
I was
like, what happened?
So I was a triathlete. I was a marathon runner. Yeah. I did lots of stuff. And one night I stayed late during anesthesia, and then I was the first off the next morning. Yeah. And so I thought, well, I'm just gonna go for a nice bike ride. I was in like Flagstaff, Arizona, so it's beautiful mountain country, and I'm like, I have the whole day to go ride my bike. This is
no traffic.
Stars have aligned. Yep. Yeah. And so I started on my bike ride. I got about 1.5 miles away from, maybe half a mile away from the house that I was staying in. And a teenage girl was pulling out of a blind driveway. I T-boned her.
Wow.
And I was going 24.9 miles an hour.
That's fast.
In a 25. So
fortunately,
very lucky.
Yeah.
I wasn't going too fast. But the unfortunate thing was that I ended up flying through her window, and then I hit my face on the side of her car. I broke every bone on the side of my face. I split the optic nerve, so I can't see out of this eye anymore.
Wow.
And then my hand went through her window, and then I broke my radius, mid shaft radial fracture. Got compartment syndrome in that arm.
Oh my gosh.
Which I still have some numbness in here. So that does lend to a little bit more difficulty when palpating. Okay. But I've been able to work around it.
Sure. Did you end up like in her car?
No.
Like just in a heap, like in her car?
Yeah, this is the worst part. So I did that. I broke the window. I flew over. And then as I'm flying over, I smacked my head on the ground. I don't remember anything from 2 days before to a month and a half after the accident.
Oh my god.
Which is kind of a blessing.
That's a lot of time.
Yeah.
Okay.
Yeah.
Do you remember anything from that period, like almost like you're in a dream state or something like that, or like in another parallel dimension or
I
something? Like
wish I
you were
did.
just it was just black,
Yeah,
like just
it's completely
nothing.
gone.
Wow.
Yeah. My
Would you
wife
call
sure
that an
does.
NDE? Like, did you die or no? Like, were
Uh,
you totally, your vitals are still carried through that whole period? Like,
So I'll finish this. I'll finish the story
okay,
here, and then
okay,
you can decide.
okay.
Um, so I ended up getting um, I get an epidural hematoma,
Hmm.
and so that was the first bad news.
Mm-hmm.
Um, Fortunately, we were right next to a regional hospital,
Yeah,
but they
like,
weren't like a trauma center.
oh, okay.
So no, unfortunately.
Yeah,
So
yeah.
they picked me up, took me to the regional hospital, and then they flew me to Flagstaff
Mm-hmm.
because that was called Cottonwood Regional Hospital, I think. Um, and so they flew me to Flagstaff. Fortunately, they had a locums doctor there
Mm-hmm.
from Phoenix, like one of the best neurosurgeons in the world.
Wow.
And so he was the one that did my surgery, and I was
Damn.
so lucky.
That's super lucky.
They also had a facial plastic surgeon locums from
Yeah.
Phoenix. This is like a really beautiful area, so
Wow.
it's why they wanted to do
Yeah,
locums
yeah.
there. And so I was really lucky because I mean,
Jeez.
you can hardly tell I've had
Yeah.
broken every bone on the side of
Wow.
my face. Like
Wow.
my
That's
facial
incredible.
plastic surgeon, I've never met him, don't know anything about him, but they did a great
Wow.
job.
Wow.
Yeah. And so I had lots of intraoral surgeries.
Yeah.
I broke my ribs on all my ribs on both
Oh
sides,
my
and
gosh.
it was not a good.
So I mean, as like an osteopath now, like you must know all of these dysfunctions inside and out. You know, like how does that impact like how you function like on a day-to-day basis?
That's a great question. So
Yeah.
really, I've had to learn so much about my body,
Yeah.
um, and to know how I function.
Yeah.
But also, that's helped me to know
Mhm.
how I can function and how
Mhm.
I can work around it.
Mhm.
Because I'll tell you, recovering from a brain injury with physical impairments,
Mhm.
like neurologic physical
Mhm.
impairments, like I had drop foot, I couldn't move my
Yeah. Yeah.
leg,
Yeah.
I was numb on this whole right side of my body,
Yeah.
like I couldn't do things. I had to
Yeah.
figure out ways around it
Yeah.
to still do it safely and
Yeah.
effectively.
Yeah.
And knowing those skills for myself has really helped me to come up with creative solutions for my
Mhm.
patients.
Mhm. Mhm.
Because it's not just studying academic stuff,
Mhm.
it's applying real world principles and applying them to your patients to help them in their lives.
So looping back, you were a pathology attending for a
Mm,
while, or a
no, so
resident, or like
yeah,
so. What was that
yeah.
transition like?
So part of my issue is I had a really bad brain injury.
Hmm.
From me hitting my head on the ground, I had
Yeah,
a really bad brain injury.
yeah.
So it's called traumatic, or it's called what's it called? Um,
Is this part of the brain injury? No, I'm just
yeah,
kidding.
partially. Yeah, it's
Memory
called
loss.
what was it? I gotta remember the medical
Other than
name.
the epidural hematoma stuff.
Yeah, the
Yeah.
epidural hematoma was taken care of.
Uh huh.
Um, but this one is called, it's like shaken baby syndrome for adults,
Yeah.
basically.
Wow.
I can't
Is
remember,
it like a?
diffuse axonal injury.
Yeah.
That's what it's
Okay.
called. And so basically, I mean, because it's diffuse throughout the entire body,
Yeah.
all the axons. So it's that white matter. We all learned about this in
Yeah.
med school. The white matter shifting on the gray matter,
Shears. Yeah.
and you
Shears.
shear all those
Wow.
axons. And so all the stuff that I learned in medical school was all there. There was
Mm.
just nothing connecting it. So I
Mm.
relate it to a big switchboard, like those old time
Mhm.
switchboards in
Mhm.
like the 50s.
Mhm.
And you just walk to the switchboard and pull all the wires
Yeah.
out.
Right. Right. Right.
And then you just got to slowly
Like reconnect
put them
things.
back in,
Yeah.
and that's therapy. That's what I
Yeah.
had to do every day.
Yeah.
So after that, I came out of my coma. I think I woke up about um, it was about a month and a half is when I can start remembering.
Mhm.
My wife has told me that I was unconscious for about 10 days,
Mm.
which is ironically,
Mm.
that's like the distinguishing factor between a good
It's
prognosis
like a
and a bad
cutoff point.
prognosis.
Yeah.
Yeah. So I was like right on the border.
Yeah. Wow.
And still, I've had an amazing prognosis. I think
Yeah.
most the statistics I've read, um, you know, those with a diffuse axonal injury and especially with an epidural hematoma, 50% of them die on the spot.
That's crazy.
They don't survive
Wow.
the accident. And then of those 50%, you have another 50% chance of being in a persistent vegetative state.
Okay.
And so
we're in the 25%, and now what percent of that becomes functioning physicians?
Well, that's
0.001.
Right. Yeah. So the statistic I found, because I couldn't find one with physicians, but the statistic that I found was gainful employment.
Yeah.
So it's like working a job at like Sears or McDonald's or something like that. And that says the vast majority. So I'm saying, let's say, be generous, let's say 90% don't achieve that.
Yeah.
So we're down at like 10%. So that's 2.5%.
Insane.
Yeah. I'm very lucky.
Yeah.
The predicting factors before that had to deal with my my high premorbid conditioning for my physical conditioning.
Being an athlete,
very a big athlete.
Yeah.
I had cognitive function beforehand, a really high level of cognitive function.
Yeah.
I don't want to brag, but I scored 90th percentile on USMLE.
So your brain was functioning well.
Yeah.
Yeah.
And the last one, which is one of the most important overlooked things, is family support.
Yeah.
Having that family support, that close, tight-knit family supporting you. I was very lucky and had a wonderful wife.
That's the spirit component.
Absolutely.
Yeah.
Absolutely.
Yeah.
So I had I had my wonderful wife to be able to help me through that.
Right.
She's done so
She was there
much.
the whole time.
Yeah. And
wow.
I just owe it all to her. She's amazing.
When this happened, so was pathology what you matched in through the military, and you were just doing that because you're like, this is what I can do, or was it kind of a mix of like, this is what I can do, but also I'm kind of interested in it, but I still want to do OMM? So like, how did you make that decision of like, where do I go after my recovery? Like, what happened?
So great.
Yeah.
So this also deals with the interleaving factors of my story.
Yeah.
So I ended up with that diffuse axonal injury. I had lost my ability to speak clearly and coherently.
Wow.
I mean, okay. I could mumble just fine. I could kind of mutter out some words and talk, but I couldn't clearly articulate myself. Which you listen to me now, and most people don't.
No, I would have no idea. Like that was in your history at all. Yeah.
So beforehand I was not able to put words together really.
Wow.
But that's come back because I've worked my butt off and tried to really hard, and I've struggled to work hard and do that. But what? Oh gosh, now I forgot where I was going.
With pathology and like where you saw your career going.
Yeah.
Yeah, with all of these things you were dealing with.
So with pathology, so I was going back. I forgot how far back I was going.
Yeah.
So when I went to undergrad,
I
knew I wanted to go to med school. But I didn't know how. I didn't know. Again, I didn't know what undergraduate degree to choose. I was like, maybe I just choose chemistry or biology like everyone else does. Like, it's like, but that's so boring.
Yeah.
Like, I don't think that.
I mean, I was neuro and sculpture, so I want to completely
that's
different.
Super cool.
Yeah.
I'm like, I just need something to stand out and something that's going to prepare me well, other than studying, fruit flies. Like, I don't want to do that.
And the Krebs cycle for 10 days. Yeah.
Yeah. And I mean, the Krebs cycle's fine, but not, everything about it. So I had an incredible mentor in the College of Health Sciences at Weber State University. Her name's Yaz Simonian. She was the hematology professor over the medical laboratory sciences program. And I'm like, I went and talked to her. I said, hey, I'm interested in going to medical school. She's like, boy, do I have a deal for you.
Yeah.
She's like, if you want to learn the whole pathology course that you take in medical school over 4 years of undergrad, you can get started right now.
Yeah.
I was like, oh, I'm listening.
Right.
I'm listening. And so by the end of that conversation, she had me signing up for her class.
Wow.
And so you get into the program. It's usually a 4-year program, and part of the deal with me going to med school or deciding that I was going to take the MCAT early was I was planning on double majoring in German and in medical laboratory sciences. But then when I took that MCAT and scored super high and I just applied, I forgot to think about one little thing, that I didn't have a degree.
No BA, BS.
No, and so I was like, dang it.
You're like, that's a problem.
Yeah. So when I got accepted, I was like, oh, I went to my professor and I was like, oops, I got into medical school. Can you help me out? And medical laboratory sciences was like, no, we can't. Like, there's too much lab time. We can't have you double dip, like doing all that classes. But my German professor, I told her, and she's like, wir schaffen das. And she's like, we'll help you with it. We'll complete it.
A degree in German.
Yeah, so I got a degree in German, but I was doing the whole Hermione Granger thing. Like, I was taking 2 classes at the same time. I think I took like 36 credit hours that last semester, and I finished the degree.
You're probably one of the only German majors in DO programs, like when you were a student. That's wild.
I think I met one other DO that was a German major. Yeah.
In existence.
Yeah. Anyway, so that's how I got into pathology.
Into pathology, yeah.
And I was thinking,
very cool.
Yeah, like, okay, I'm into pathology, but so I have that background. But
so you're like, I could do this. I could see myself doing this as like a, clinical thing. I mean, you are using your hands, right? You're like setting up slides. But there's no patient care, which you probably
I love
wanted.
people.
Yeah.
I love people.
Yeah.
And so I didn't like that. Well, and that's okay. But the biggest thing for me, especially when I couldn't think clearly, the biggest thing for me was that I couldn't talk, and I think I was just probably going to set myself
frustrating.
up. Yeah, I was just going to set myself up for being sued if I couldn't talk with patients.
I mean, it's totally things could get misconstrued.
Yeah,
you're not able to dictate your notes.
Right.
Like, okay.
So I was like, okay, I guess it has to be pathology, because I was like, if you do a radiology or something, but like, who's going to want a brain injured person for radiology or pathology? Like, I'm throwing it out there.
But isn't pathology like pretty competitive?
Super competitive, yeah. But I mean, so my options were either go for family med, which I definitely didn't want to do.
Yeah.
And I didn't think about osteopathy because I had removed it from my mind because I was in the military.
Yeah.
But then and then the other part of that was that I got medically discharged. So I wasn't allowed to serve.
Oh, wow. Because of the
sucked.
injury.
Yeah.
Damn.
So,
okay.
Yeah.
So you applied pathology. Was it a pretty grueling interview process? Because I'd imagine, like, not being able to talk, like, how do you interview for your program?
I think God helped me a lot there.
Yeah.
But yeah,
helping hand. Yeah.
Yeah, just seriously.
Yeah.
So I did interview, and I think the program I matched at, it was Arizona, so it was the same state I was living in.
Yeah.
I ranked them high, so I was happy with it. But I don't know. There's definitely this feeling like it's not what I wanted to do.
Yeah. At its core.
Yeah, it's definitely
like something's missing.
Yeah, it's definitely settling, but I was making the best of a bad situation.
Yeah.
And so my first 2 rotations were autopsy. Not a whole lot of talking to patients there.
You would hope not.
You'd hope not, right?
You would hope not. Yeah.
Well, you hope not. But you have to call the families of the decedents and tell them why their loved one died.
Yeah.
Which is not an easy conversation for anyone to make.
Even without the speech issues.
Right.
Yeah.
And so after my, probably 10th autopsy, my attending's like, all right, you're ready to do this? Hands me the phone. And I'm like, huh?
Yeah.
And so I'm over here like, this is an incredibly important conversation I cannot mess up. Like, this is someone who is heart-stricken right now. And
this is like a core memory moment of this person.
Yeah, exactly. And I'm like, I cannot mess this up. So I remember my first one, I'm just trying my hardest just to say something intelligible and that they will enjoy or be happy with. And so I tried hard. I probably messed it crazy up, but after I kept doing it, kept trying, I kept pressing myself, I kept working hard, my speech started coming back and it started to flow. And I was like, neuroplasticity is real.
Did you practice like in any way, like
I
talking in the mirror, or like through any kind of like, I don't know, how did you get there?
yeah. So one of the best things I did was I had a brain injury therapy group that I went to. I was I was outpatient. It was at the hospital, and I did an outpatient therapy there 4 days a week, and I did that for about 7 or 8 months.
Yeah.
And
4 days a week.
Yeah,
Yeah.
it was their goal to get me to pass the boards, because that my school said, you can come back, but we're going to set the bar high. You have to pass step 2 before you come back.
Yeah.
And I was like, I'm not even done with my 3rd year yet. I'm almost done, but not quite. And I'm like, okay.
Wow.
That was the high bar that they set.
Yeah.
So my therapy's goal, and it was set up so amazingly. I mean, I had speech therapists, occupational therapists, I had neuropsychologists, I had recreational therapists, I had everyone working collaboratively together to help me to achieve what I needed to achieve.
Yeah.
And so that's really what made it possible. It was a collective effort from so many people.
Do you feel like you're back to where you were? Like, obviously not fully back to prior to the injury, but do you still feel like you have more work that you have to do, like to get to where you want to be?
Such an excellent question. So I would phrase that. I'd kind of bring that question back.
Yeah.
I'd say, do any of us feel like we are at the optimal state?
All the time? No, I'm just kidding.
Yeah, no,
definitely not.
Yeah.
Like, I think we're all works in progress, and that's why life is pretty incredible. It's that it's just changing constantly. So
I feel that same way, because I feel that I am so different, different in a better way.
Yeah.
So I'm not
certainly more experienced.
Yeah, definitely.
Yeah.
I mean,
certainly probably more gratitude for like being alive and able to function and do what you want to do, right?
Yeah.
So you were in you finished pathology residency. You were practicing pathologist, like coroner, or like
no.
What were you doing?
Yeah. So that's where it gets interesting, because my speech came back.
Yeah.
And I realized I don't want to do this.
Yeah.
This
is
like, not going to lead.
This is an opportunity to like switch it up.
Yeah. I'm like, this isn't going to lead to a happy life.
I'm not in the military anymore.
Exactly. Yeah. So I'm like, the world is my oyster. Like,
and when did this happen? This was years ago, or like?
Yeah. So my injury was 2012.
Yeah.
And then I ended up going back to school in 2013, almost a year to the date of my accident.
Wow.
I went back to school, which was, actually, no, that was when I took the boards, was a year from the date.
That's pretty crazy.
And it was,
talk about a recovery.
It boggles me still.
Yeah.
And then I went back to school, I think in May, and I finished up my 3rd year rotations, and then I started on my 4th year rotations. And so, yeah, that's how that went.
Yeah.
I forgot the question you asked.
No, that's a good pause. Okay. Let me just check real quick. Oh, you're good. Oh, it's all good. Thank you, though. No, we're good. We're at like a half hour here. Okay, perfect. Was it my face?
Yeah.
Okay. Thank you. You're like our assistant kind of over here. How's this? Better? I'm keeping all of this in, by the way. It's still slightly cut off.
Yeah, come on. There you go.
Here. Better?
It's like your forehead's off.
Yeah, it's okay. My forehead's whatever. No, it's fine. I'll just keep it there. Thank you.
Oh, wait. He's off.
I'm off?
Yeah. Okay, perfect.
A little bit more.
All right, like this?
It's still kind of cut off, but it's better than before.
Okay.
It started going to where, like, this is what, like, you can't.
We're just a bunch of eyes and mouths.
Hello.
It's fine. Okay.
But I think that's right.
All right. Thank you.
Thank you.
Are you at the conference?
My husband is.
Oh, okay.
Cool.
Sorry if we're like boring you or anything.
I'm getting work done. So I do.
Oh, okay. Perfect.
Nice.
So where we were going was you were at this juncture of like, okay, maybe I can pursue what I've really wanted to pursue all along. And you were how many years out of school at this point?
Oh, yeah.
Training?
So we were going over 2012 was my accident. 2013, I went back to school. 2014, I got into pathology residency.
Okay.
And then 2015, I finished my internship and was like, I'm not happy.
This is over 10 years ago now.
Yeah.
Wow.
So I'm like, I'm not happy.
Yeah.
This is not going to lead to a happy life. Like,
Yeah.
I love the science. I just don't like the practice.
It's not like fulfilling for you.
Yeah, exactly. And so I knew that I needed to switch. So I talked to my program director about switching, and I didn't know what to switch into.
No.
Because again, maybe, I don't know, maybe it was a brain injury. I don't know. Maybe it was just I wasn't thinking clearly still. I hadn't given osteopathy a single consideration.
And that's, I mean, just an aside, like that's why what my personal mission is. That's why I make these videos. That's why I'm like writing a book. That's why I'm like trying to do outreach in social media, is because I want it to be a known thing for students. I want it to be like one of the first things. So like, yeah, I could do OMM as a specialty, right? Yeah. But anyways. So,
no, I mean, this is the perfect situation that I wish, I say I wish.
Like, let's say you watched a video like this back then.
I would have been like,
and you're like,
that's what I got to do.
Oh, okay.
Yeah, that's it. That would have been my, would have been my anesthesia moment for that, right?
Sure.
So yeah, that was, so 2014, and then 2015, I finished my residency, or I finished my internship. And then I said, okay, my internship's done. I got AOA credit for it. Because I did study with the Tucson Osteopathic Foundation on, as well as going to residency, just because I'm like, this is interesting to me. I want to continue learning it, because that just came from me. Yeah. And so I did that myself. And then I submitted those credits to the AOA. I said, I don't know why. I said, I don't know why I'm doing this, but I feel like I should do this. Yeah. So that was,
it's like the hand of AT still.
Yep.
Click the button.
Yeah. So that was a very incredible decision right there that I did that. Yeah. Because then, after that, my wife and I were just like, what do you want to do? Like, I have no stinking clue. Like, no idea. I don't know what to do. Yeah. And so, she made the comment. She's like, well, why don't we just go home, and why don't you work at Weber State? I was like, I have no clue why they would want to hire a physician, but okay, like, I'll just see. So I checked on the job board, and they were hiring a clinical chemist. And I was like, well, that was kind of my favorite part of of pathology. So I'm like, all right, I'm not out of that idea. I'm not gonna say no. So I had to get the certification for medical laboratory sciences in like a couple of weeks. So I did. It was a lot easier as a pathologist.
Yeah, sure. Yeah, you're like, okay.
Yeah, like, I just
been through stuff.
Yeah. And so, and I say pathologist. I finished my internship, so I wasn't a board certified pathologist, but I was a pathologist. Yeah. And so I then went back and I passed that certification. So I was in the pool to get to apply for that job, and then ended up flying out there, or driving out there, getting the job, and we ended up moving there. And that was 2017. We moved there. Okay. So I was like, all right, that's fine. I'm not going to get to live my ideal as a physician, but I'm happy. This is fine. But again, it was fine.
It was kind of settling for something.
It was fine. It was okay. Yeah. It was fine until I ended up getting tenure. I ended up doing some amazing things.
Over how many years?
I was there for 8 years.
Wow.
And so I ended up, I was the pre-medical advisor to my whole time there. And you'll love this. I sent over 50 students to medical school. Yeah. I had one person, and I'm not going to say he didn't make it, because he decided after he took the MCAT to not apply anymore. Oh. So he'd never applied. So I don't count him really as a not. So I had 100% acceptance. Wow. I'm like, that's great. It's a little bit better than average. Yeah. But the coolest thing is that over 70% of them went DO. Hey. And awesome. I did not push that at all. I just said, you can do MD or DO.
You're like, here are the options. Yeah. And honestly, a lot of pre-med advisors are just like, here is the option. Yeah. It's MD school. So, I mean, and I had the same thing. My pre-med advisor literally taught me about osteopathy. Wow. I had no clue. She's like, you're a sculpture major and you're a neuroscience major. Why aren't you applying to DO school? I'm like, oh, what? She's like, osteopathic medical PCOM is down the street. I was like, oh. Let me just look it up real quick. Oh, that's what I want to do. Yeah. So this is fast forwarding to what, like 2024 25-ish or something.
20,
And so like, what was
24.
that moment where you're like, I'm gonna apply to an OMM program?
That was the key. So
Yeah.
it started out, and this is kind of the unfun part. There was some big negativity from the leadership toward me in my department.
Yeah.
And it wasn't just toward me; it was toward a lot of other people. And
it's like Game of Thrones situations.
Exactly.
I get it. I'm in academia.
Yeah. So you saw like it was just knocking off one, knocking off the next, knocking off the next, and I was next in line.
Yeah.
And I said, you know what? So I had, I think the last straw. It just kept taking things away from me and away from me. Kept taking more things away from me. I'm like, I'm not doing anything wrong.
Yeah.
I'm actually one of the better professors here.
Yeah.
But yet I'm getting all the flack.
Yeah.
Why is this happening? I said, it's not deserved. So, and one of the big things is I'm still an author. Or I was an author, and I'm still the program director for the NEST program, which is it's run by ScholarRx and USMLE-RX.
Okay.
That's the company who makes first aid for the USMLE-RX.
Oh, okay.
I'm
writing a book now, so we'll have to talk at some point.
Absolutely, yeah. I've written for them for
I've never written a book,
decade,
and so I'm just no idea what I'm doing. Anyway,
well, okay. we can chat because I know a thing or two.
Okay, cool.
So, where was I?
So you're with this program, and you're getting ready to be guillotined, essentially.
So this program, they had this great opportunity to do a presentation in Switzerland.
Yeah.
And I'm like, okay,
like I'm down.
This is an amazing opportunity for our university to get exposure.
Sure.
For me to go to Switzerland to give a presentation on something I've done for the last 15 years.
Yeah.
This is amazing. This is like one of my life's work almost, because I was in education forever.
Yeah.
And then my department chair said, no.
For no real good reason. Yeah.
He said, we will not support it.
Yeah.
I was like, what?
Why?
Yeah, like this is medical education.
Yeah. Other than the funds, like why?
Yeah. I'm like, wow.
That's frustrating.
So and I was like, that's the last straw.
Like, I'm out.
I'm done. So I'm not getting any support with this. Oh, and I also was trying to do a research project, the American College of Lifestyle Medicine. It's an amazing research project. I got over $500,000 at the ACLN has, so I've gotten tons of support from it everywhere. And then I kept trying to get support from Weber State to do it, and never succeeded. It's like, how? Like, this is a little dinky college. Like, why are you guys not behind this?
Right.
I mean, this can make actual like effects in patients' health.
Yeah.
Not just like a super cool
obscure project that doesn't get used.
Yeah.
Huh.
And so I've come to find out that my department chair was on the board of those research things and was knocking them off.
Yeah.
And I'm like, okay, fine.
Yeah.
Like, and so it's, you have this amazing work that can be done, and yet, so I'm just like, I'm getting nowhere with this, even though I'm succeeding. And then he tried to stop my my bid for tenure as well. But since tenure is a very hardly relegated process, and I know all the rules for it, you do all the things and you get the tenure.
Yeah.
So
it's like a checklist.
Yeah. So I did all the things, and so he had to give me tenure. But he then cut an hour off of all of my classes. So which impacted me financially too.
Wow.
And then he gave me an extra class.
Yeah.
Which I was not. I mean, that's not my thing. He's like, go teach this lab class. I'm like, I've never taken this lab class my entire life.
Yeah, you're like, I've never even taken this class.
Yeah, and so anyway, so it was just a bad situation. I was like, I just can't do this. When I got tenure, he called me in. This was the last straw right here. He called me in, and he said, "Congratulations on getting tenure, Scott."
Yeah.
He shut the door. He said, "But you are not a physician."
Yeah.
I was like, okay. I just
like, wow.
Shut up, and I was like, that is amazing.
Yeah.
Thank you for showing me that, because I am out of here.
Yeah, that is insane.
So
he's dealing with some demons.
Yeah.
Wow. Okay.
Yeah. So after that, I went camping in Colorado with my family, and I said,
reevaluate some things.
But this was super
Mhm.
late. This was like December, January.
Mhm.
And I was like, what am I going to do with my life?
Yeah.
I don't know. And then I remembered, I'm like, wait, there's osteopathy.
Yeah.
There's osteopathy.
It's been there the whole time.
Oh my gosh, it's been there the whole time. And then,
yeah.
and I now knew this because I was the president of the Ogden Surgical Medical Society there.
Mm-hmm.
And that was what frustrated him, because I wasn't a physician, but I was succeeding as a physician.
Right.
And so I had invited the OMM, an OMM physician from Rocky Vista University to come up from St. George to come teach at our conference.
Which physician was it?
His name was, gosh, what's his name now? I would remember.
One of my mentors taught there.
Oh yeah?
Was it Jason Hartman?
No.
Okay. But anyways,
he's my age. Curious. He's my age.
Yeah. So he kind of influenced. It was like gave you some insight.
Yeah, and I was just like, and I talked to him. I said, listen, and this was probably 5 years ahead of when I made the decision.
Sure, right.
But I said,
this is what, like 2020?
20? No, it was like 20. Yeah, 2020.
Yeah. Okay.
And
pre-COVID, post-COVID?
Mm-hmm. No, like COVID, pre-COVID.
COVID-esque.
Yeah.
Okay.
Maybe 2019. Maybe.
Yeah.
Yeah. So I talked with him. I said, listen, like, if things go crazy, like, I might be interested in doing that. Like, just throwing out feelers, just seeing what's available. And he said, you got to do this. Like, he's like, if things don't work out at Weber State, you need to do this. Mm-hmm. So that set the seed. Mm-hmm. So it was a great mentor, and he was the one that did that. Mm-hmm. I mean, we're the same age, but he went and did that first, and then he actually went to the same program that I'm at right now.
And you're at where again?
I'm at ATSU, so at Northeast Regional in Kirksville, Missouri.
Yeah. They're like the mothership.
The mothership. It is. It's
for anyone who's watching and doesn't know, that is like the first osteopathic school. Mm-hmm.
It's amazing.
That's incredible.
Yeah, we have
very osteopathic, and not all osteopathic schools are like super gung ho about osteopathy, which is, you would think, is kind of ironic, and it is, but that's just the nature of it. So you're doing a 3-year program, 1 year.
So that's what comes in with
you've done an internship. So you do the OMM too.
But it wouldn't have counted if I wouldn't have gotten that AOA accreditation.
Oh, so
that's where it comes in.
That's the big callback.
Yep.
Yeah, and you just had a feeling. You're like, I just have a feeling this is gonna be helpful,
and I have no clue why.
Yeah. Huh.
Yeah.
Okay. So just listen to your intuition, folks.
Seriously.
So you're kind of finishing up, right? You're in your last year, taking the in training, then you'll have your board certification. Mm-hmm. So like, what do you want to do after that?
So after that, I'm signing. Well, and this is I'm signing with. I signed with a physician-owned, 200 physician-owned private practice.
Okay,
in
very
Layton, Utah.
Yeah.
And this is a deal. Since I was the president of the Surgical Medical Society, I had done my conference on lifestyle medicine.
Yeah.
And really talked, and I kind of sold all the physicians in the audience. Like, this is important, guys. We need to do more lifestyle medicine.
Yep. And
they said, wow. Their board of directors, like all of them came to me because I was on the board with them. Sure. I knew them all. Yeah. And they said, we need to hire you.
Yeah.
It's like, well, you can't, because Utah's got this weird law that you can't just have 1 year of residency. You have to have 2 years of residency. And I don't have 2 years, so I'd have to go back to residency. And they're like, well, we have a family medicine residency. And I'm like,
I don't want to.
I don't really want to do that. Yeah. And so.
And it's not OMM related. It's not OR accredited. Yeah.
And so I realized, I'm like, I can just do this. And this was January. So I made a couple of quick calls.
Yeah.
I called the program in, the big ones I called were the program in Kirksville. That was my first choice.
Yeah.
And then I called the program in Florida, like Largo or something like that.
Larkin,
yeah. I called that program because I was like, that's where I wanted to learn. Florida, just because living in Florida would be neat.
Yeah.
And they had a really cool structure where they got to teach students how to do like injections as well, and they actually got to work in the private practice clinic. So it was a private practice that was really geared toward what I was trying to build my practice to become.
Yeah.
So that was the drive there.
Mm-hmm.
So that was second choice though.
Mm-hmm.
And then, but my first choice was going right to the heart of osteopathy and learning it from the experts.
Yeah.
And I am so glad that I did, because we have so many attending physicians. You have a new one every single day. And they are all experts in their own little special niche of osteopathy.
Yeah.
So you have expert in BLT, you have an expert in HVLA, you have an expert in like FDM, you have an expert in like myofascial release, and then you have Dr. Karen, the department chair. She's just amazing at everything.
Dr. Snyder.
Oh my gosh,
she's a good friend of mine. Shout out to Karen.
Yeah, and Dr. Eric, her
she's one of my favorite people.
Yeah. And they both are. Dr. Eric's just
at first
she was. Too.
I was like, you're a very intimidating person, but she's so sweet. Like
she is.
Yeah. Let me just make sure we're all good on this timer. Yeah, perfect.
I had the same feelings. I had the same feelings as you. I was like,
Dr. Snyder.
At first, like when I started,
she'd probably watch this and laugh at that, but
yeah.
So you're gonna sign on with this private practice. Now, let me guess. There is no OMM providers there.
There are 0 OMM providers.
Knew it. And so what is their like, do they know what they're getting into hiring you? Like, what is their outlook on osteopathy, on OMT? Because so for a lot of people watching, a lot of students are like, what's the end game? Like, how can I actually work and do this? And so I've started private practices. I've been part of other practices. I'm in academia, so I've done kind of it all. But I want to hear from your perspective, like, what was that negotiating process like? Like, what perspective do they have on any of that?
Really great. So they do have a little bit. They have a couple of providers that they're DOs.
They have DOs, yeah. So they kind of know loosely what. Yeah.
And they do bill for osteopathic manipulation.
Okay.
I mean, it's like maybe 1 or 2 regions. It's not 7 or 8 or 9 regions like we'll do. But yeah. So they know how to do it. But I don't fully know if they fully recognize, yet, because as we say,
they don't have a specialist.
Yeah, and as we say, the proof is in the pudding. Once I get there and I start treating patients, that's when people will start to flock.
That'll be the light bulb.
I'm confident in that.
Yeah. Do you have other tools that you like to use? So, like for instance, like I'm also an acupuncturist. Picked that up during my residency. What would you describe your like style as? Like when you're treating? It's
a really great. So I love direct treatments. So osteopathically, I'm a direct.
Kind of old school.
Oh yeah. Direct articulatory. That's me. Yeah. Counter strain. I'd like that too.
FDM.
Love it. Yeah.
Yeah. I'm like teaching it to myself now.
Yeah. But it works. It works really well. I like that. I do some indirect techniques, and like honestly, sometimes it's always with the ribs. Always the ribs.
Yeah.
And I'll sit there with the rib and I'll try to treat it direct with the myofascial release. Nothing. It's not moving. Or I'll do muscle energy on it. Nothing. I'm like, fine.
Yeah.
I will just go and do this indirect. So I'll put it indirect, and then all of a sudden, there it goes. I'm like, you've got to be kidding me. It falls right like the second I put it in indirect.
I learned some cool rib techniques from Hugh Ettlinger.
Oh man.
Yeah, I still use them. Pretty elegant stuff.
Yeah.
So you're a direct guy. I mean, I love direct approaches too, but I do not a ton of cranial osteopathy. Like when a lot of it is just kind of when I see the infants in the hospital or when I'm doing like, are you going to be doing inpatient work like for this group? Because that's a big opportunity.
Yeah, it is, and it really. So, and I got to find. This is something about my structure and how I want to not overwhelm myself. And so I'm trying to figure out, okay, how fast am I going to build this clinic?
Yeah.
And then, I mean, I would love to do inpatient, but that's a completely different lifestyle.
Yeah, and you really have to get buy-in from the hospital, and they have to change their bylaws, actually. At least that's how I got it pushed through. It took a year.
Oh my gosh. So I'm sure that would be the case. I am credentialed at 2 hospitals now in the area.
Okay.
So and they're aware of it. They have had physicians do OMM before, just not specialists there before. So I will. I can do that, but it really kind of just depends on how quickly my clinic will build.
Yeah, I mean,
Um,
really, the only way you're gonna know is like when things unfold and like when things happen, taking it a
mhm,
week at a time, even a
yeah.
day at a time, just seeing. But what's nice is you do have that big network already built that can just like funnel you all those fun cases where they're
Mhm.
like, we don't know what's going on. Send them to the
Right.
OMM guy.
Perfect.
You're like,
Yep.
that is what we do.
Yep.
Um,
Well, and
so
that's a
yeah,
good thing. Oh, sorry.
no,
That's
no,
another
no,
good thing. So
yeah,
acupuncture, like
uh huh,
I love acupuncture.
yeah,
I'm totally behind it.
yeah,
I've learned so much about it. And that's just been kind of a personal thing as I've
hmm,
watched and I've seen the efficacy,
yeah,
especially for like weird cases. Like
very
I've
fun
had
stuff. Yeah,
I've had a patient
yeah,
and she has just struggled from debilitating anxiety.
hmm,
And I'm like,
yeah.
okay, how do needles change
Yeah,
anxiousness? Like,
yeah,
really? Like, how are you going to do
yeah,
that? And I'm like, I was
yeah,
skeptical at first. And my one of my preceptors was, she went to
yeah,
Helms
mhm,
and she said, like, just trust me, let's do these points. So I chose some points with her. I helped
yeah,
select the points and I'm like,
yeah,
okay, let's try this.
yeah,
She came back like a week later.
mhm,
She's like, I feel like a new woman.
yeah,
I'm like, what? And
yeah,
after that, I'm like, okay, let's keep doing this, but then let's do more points.
mhm,
Let's do some
mhm,
electric acupuncture, and
mhm,
let's keep building on this.
mhm, mhm,
And so we have, and she
yeah,
has completely turned around her life.
mhm,
She's a completely different person right now.
mhm,
And I'm like, the only thing we did was stick needles
yeah,
like to you and put electricity on them. Like that's
mhm.
all we did.
Like
And
I
wait,
said,
I
the
mean,
fMRI doesn't lie.
it was
It shows those brain activations
so
and
true.
those changes in their cortex.
Yeah.
And I've seen it too. Like I had a case. I actually, so a lot of the psychiatry residents rotate with me, and
Mm-hmm.
I had a case of
Cool.
someone having an active panic attack in my office in front of me,
Wow.
because of a lot of domestic abuse, a lot of substance use disorder. And it was just piling and piling on. And she was referred to me from psych
Okay.
because they're like, we just can't. She won't even take her meds. Like
Huh.
we can't even handle this. So luckily, she came in with like a very supportive friend and her neighbor. She's just broken down in tears. She could like barely get any words out, and I'm like, just lay down. Like I know what to
I
do
got
here.
you.
So do ATP protocol, so
Hmm.
auricular trauma, right?
Yep.
I loaded up both ears, and this is the trauma, or this is the protocol that they use for like military level PTSD,
Hmm.
right? Like
Wow.
combat. And but this is what her body was going through, was like acute sympathetic reaction. And so I put him in, and I was like, just lay down and just try to take a nap. And she was kind of like calming down a little bit. Put another GV20 and yin
Hmm.
tong, so like these 2
Yeah.
points are
Nice.
really calming.
Super good.
And then I just said, I asked her, I'm like, hey, do you want your friend to stay? Do you want her to go? She's like, no, no, I want her to stay. I want her to stay. I was like, okay. Um, and so 20 minutes goes by. I take the needles out. The next day, I told her, I'm like, you might feel kind of weird. You might feel really sleepy. I just released a lot of endorphins,
Hmm.
reorganized a lot of things in your brain. And she's like, I'm just so tired. I just want to go home.
That's so not
Yeah,
normal. Like what I get too.
yeah,
Anyway, sorry, I
yeah.
interrupted you.
No, and then the next day, I get a call from the senior psych resident. I'm like, oh no, like what did
What'd
I
she
do?
do?
And she's like, hey, what did you do with my patient? I'm like, I did an acupuncture treatment. What do you mean? Like, is everything okay? She's like, she is literally a different person. She is like, we
Wow.
need to do a case report. She actually came in smiling. I don't even know what her face looks like because she's smiling and it's so different than her baseline. She's like, what the hell did you do? And I was just like, trauma protocol, a couple other
Wow.
needles, and just like let them do their thing. Um, so
Amazing.
yeah, that's all to say. Like Acu in combination with OMM is pretty powerful
I
stuff.
I
Yeah.
fully
So
agree.
I highly recommend that you take
Mhm.
Helms once you feel settled in. You're like,
Mhm.
I'm ready for the next thing.
Yeah.
It will extend, I think, your practice depth for sure. Yeah.
I'm so excited.
Not to
I'm
mention
sold.
just getting good with needles,
Yeah.
injections, all that stuff. I do a ton of trigger point neural therapy.
Hmm.
But anyway, so I guess tying everything up, let's say that you're watching this video 20 years ago, or like when you're trying to
Oh
figure out what you
yeah.
want to do. What message would you convey to you, like back then?
Such a great question, man.
Yeah,
I was honestly that's kind of what I was thinking. Like,
yeah.
what would I want to hear? Like back up in my hotel room, I was like,
Like you're just scrolling YouTube, you're like
yeah,
lost, you're like a pre-med, you're like, dude, I don't want to go into medicine. Like, our medicine is screwed in this country. I'm gonna just go into doing AI development and just
Mhm.
like wait for the apocalypse. But
Yeah.
that's a whole other video. What would you say?
You know, it would be short and sweet. If you love body movement, you love sports or athletics,
Mm-hmm.
or
Mm-hmm.
you just love helping people, and then those three things, you can gain such an incredible knowledge of with
Mm-hmm.
osteopathic medicine.
Mm-hmm.
You not only gain
Yeah. Doing a podcast.
yeah.
Yeah. Yeah.
Oh, thank you. Sorry, no worries.
Uh-huh.
So you not only gain a knowledge of how to of manual medicine, how to treat with your bare hands, which is so empowering and so
Yeah.
cool.
Mm-hmm.
But you also have there's like a spiritual aspect
Yeah.
to feeling at one with your patient and
Mm-hmm.
feeling at one with yourself. And
Mm-hmm.
that's one of the most important
Yeah.
overlooked things is it makes life so much more wonderful
Yeah.
when you feel peace.
Mm-hmm.
And this specialty brings that
Yeah.
for you and for your patients.
Mm-hmm.
I don't know of any other specialty of medicine that can do that.
Mm-hmm.
And with peace comes joy.
Yeah.
I'm so happy.
And no burnout.
And no burn, way no burnout.
You look forward to Mondays, right?
Yeah. Can't wait.
It's okay.
No worries.
This is all live. But thanks, Scott. I mean, I couldn't put it better myself. Like,
Thank you.
that's why we do what we do, right?
Anytime.
And thanks for watching. Put something in the comments if you want. No pressure. Like and subscribe.